I want to welcome you all. We haven't had the opportunity to do a press conference where we could have the media here to ask some questions just due to the social distancing. So we thought we'd find a venue big enough where we could do that. Most of them have been live streamed through our website or on Facebook. So what we wanted to do today is give you an update of where we're at, what direction Chemung County is heading, and so forth. So I thought we'd do is have the sheriff with me and the director of public health, Pete Pizzetti, with me. And so we're going to go through a series of slides, and then we'll take some questions. Latest numbers today, our total tests, 1,184, 55 tests pending, 83 confirmed cases, and number hospitalized 2, recovered 45, and the deaths at 1. Pete, a lot of questions in reference to recovery. When does that category grow? What do you have to do to be considered recovered?
So in terms of what we define as recovered, it's right from the state DOH guidance. Unfortunately, due to the lack of testing supplies, we're unable to use the testing protocol. So we use the clinical protocol, which includes 72 hours minimum symptom-free, in addition to several other clinical factors. So depending on onset of illness, severity of symptoms, it could be a couple weeks before they come off of quarantine.
Okay. We had some great graphs done by our planning department and by the health department. This one obviously depicts where the cases are. Obviously, the city of Elmira with 19, town of Southport with 15, veteran with 8, and this kind of helps the health department see if there's a cluster in a certain area or so forth. So it's good information to have. We try and share it with the public. Age breakdown. Probably one of the interesting things here that I see is when we first started talking about this, we were first warning everybody, if you were 70 or older, you were in the vulnerable category. But if you look, again, Pete, I'll throw it to you, look at the numbers we have below the age of 60.
So I think that's an excellent example of how this has really changed as it's gone from country to country. When we first started talking about it here, really the data we had was from China. And then as we obtained more information, namely from Italy, and then started to see our own numbers, it became apparent that it wasn't just those in an elderly category. So again, this data really does show it's ever more important for everybody, even the younger people, to practice social distancing.
All right, again, we move on percentage-wise, cases by age. Again, it looks like 50 to 59 is our largest category, 21.7%. Population COVID by race. So where this is kind of interesting in numbers that we look at and we share with the state. Chemung County is 88.7% white. Out of the positive cases, 60.2 African American or black. Our county population, 6.6%. Yet the number of people who have tested positive is 12. So this is the type of information that the state is interested in, that Pete's folks are interested in, and that can tell us, you know what, maybe where we need to send some of our resources if we see clusters or areas in the community that are higher than they should be. Breakdown by sex, 51.8% male, 48.2 female, so pretty close, about almost a 50-50 split, and who's getting the cases. A nice graph here done by the health department. Pete, maybe you could explain this. This is the graph that I think day by day, how many cases were positive, and you can see where we've spiked.
So if you're familiar with what we release twice daily, that's the running total. This is the breakdown of confirmed cases that we've received each day since the middle of March. So, as you kind of look at it, you do see a higher peak. I think the point to take away from that is it's kind of really hard to definitively say if we've reached an apex or not, but certainly over the last 7 days we've seen a downward trend in our positive number of cases. We're hoping for that to continue, but it's really anyone's guess it right now. Hopefully it does continue that downward trend.
Pete, any data that it's been coming from the east to the west, of our numbers haven't spiked since New York City started going down, I take it? I mean, is it the state kind of the same? Everybody's now looks like they may have hit the apex and may be heading down?
I would say that how we relate to the other Finger Lakes counties, we're pretty much right in line with everybody. It seems like we're all kind of experiencing the exact same regular increase average of 3 to 4 a day as this has gone on. So it's really it's been kind of very informative to see how we compare to the other Finger Lakes counties.
I'll throw this one to Pete as well. COVID tests for day-to-day, so I think basically this is the number of tests that we've given.
So, one thing to take away from this is the number of tests that have been done have been pretty static. We haven't been able to ramp up, but we haven't, bottomed out yet on the testing. So again, that goes to both the regional and national shortage of testing supplies. The county executive and I have been working behind the scenes to try and bring some more of those supplies in. As you can imagine, they are going to the highest need areas right now, namely down to the city. But we're hoping as they kind of start to move far past their apex, we'll be able to bring more of those supplies up here.
And it looks like counties our size, I've looked at Wayne County, Tioga County, our test numbers aren't that far behind theirs, or we're a little bit ahead. So there's no other county that's in our region that's done tons of more tests, unless I think Tompkins, some of them have had the opportunity to get supplies we haven't had the opportunity to get. Correctional facility statistics, it's a big question of, what's going on at the correctional facilities. Are we getting those numbers? And we are getting those numbers. Chemung County Jail has 0. Elmira Correctional Facility with 0, and Southport Correctional with 8. So, I think that speaks pretty well from what the work everybody's been doing to have 3 correctional facilities in our county and only have 8 positives of inmates. Now, we do have staff, or have had staff from those facilities who have tested positive, but as far as the inmates, that's pretty good for the number of inmates that we have in Chemung County. COVID-19 hotline stats. So Chemung County has their own hotline, so folks call for a variety of needs and questions and so forth. So to date, over 1,000 calls, which is pretty good. We have that hotline manned Monday through Friday, I think 8 to 4. They can also reach folks at Pete's office during the weekend and off hours. So the hotline was a great idea. It's receiving a ton of calls. The top 3 categories for those calls, symptoms and testing related questions, exposure concerns, and social distancing violations. So those are the 3 most popular calls that have been coming in to the hotline. New York State on Pause, that's a program. It's a New York State program. I'm going to let the sheriff talk a little bit about it. It's the mechanism that many of our residents and other residents from around the state are utilizing to file complaints involving social distancing and now facial masks.
So as the county exec said, this is a reporting mechanism for the public to utilize to report issues of social distancing or other concerns they have. Initially, they were coming in, but it was a little sporadic. I think as it's become a little bit more popular, the public's become accustomed to it and have located it. We have seen a significant increase over the past several days with these types of complaints, so much so that we have actually designated one full-time deputy sheriff just to handle these solely, instead of breaking them up amongst a bunch of different staff. I've also been in contact with the other chiefs, with chiefs of police in the county, as well as the captain from the New York State Police, just to let them know that we did have one person assigned to that. Should they get any reports aside from what we're taking in, just to make sure that information is shared and gets back to the health department. So it seems to be working very well. We're handling these complaints as they come in conjunction with the health department, and addressing them on a case-by-case basis.
And last 7 days alone, 53 complaints handled by either the public health office or the sheriff's folks. Some of them kind of minor, and we'd like to address. If you see someone not wearing a mask, that really doesn't necessitate a call to the COVID hotline or a report. We're really trying to deal with our resources the best we can, and to have to send a deputy sheriff somewhere just to say, oh, you weren't wearing a mask. So, we'd ask folks to self-police. Some of the complaints are somewhat serious. We've been dealing with Lowe's. I think we've gotten positive results there, though, Pete. Mm-hmm. We're currently dealing with Walmart, and again, I think this morning they sent in a plan, so we're working with them. And, we're not trying to pick on any particular business, but I think what we have to remember is Chemung County residents as a whole, they've done a fantastic job. I'd like to think that's why our numbers have been so low in this county. So what we don't want to do is take 2 steps backwards and have a business that's been deemed essential not follow the rules, and then we end up with a cluster because somebody who is sick at a store who gets hundreds of people a day. We just have to be careful. We just want them to abide by, what the executive orders are. And again, I would remind the folks, the executive orders don't come from county government. The sheriff's not making them up. County exec's not making them up. Health director's not making them up. We're following the executive orders that are being sent to us from Albany. I mean, it's that simple. Are we the bad guys at the end of the day? Sure we are. But if you watch the governor's own daily press conferences he does, he says, I'm running the show. I'm the boss. If somebody's mad, tell them to write me. I'm to blame. So again, we're just following through on the complaints that we're getting.
If I could just add one thing regarding the social distancing and more specific with the non-compliance with the mask. We've been contacted by the public who said, hey, if I'm walking down the street, I see somebody on the street that I'm approaching, they're not wearing a mask, should I confront them and engage them? Our advice is no. Avoid them, go the other way. If you are a citizen confronting another citizen about not wearing their mask, you're going to end up into some type of an altercation. We've already seen that happen a couple times. People are very have strong feelings about this. They're engaging people in stores and other areas. If it's a problem, just avoid them if you can. If it's an area where they should be wearing them, go to management or contact law enforcement and let us address it from there.
Yeah, you know, in another issue, I know a lot of people are afraid that what's going on is a violation of their constitutional rights, which, you know, I guess we can't argue with. I mean, the sheriff hears from people all the time that want to register a weapon or buy a weapon. We're hearing from people who want to go to church and so forth, and they don't believe in this, you know, they just don't believe in the COVID-19, the coronavirus. But Pete, I think if you're an analytical person, social distancing has worked. I mean, I think it's proved that it's worked. I mean, wouldn't you agree? New York City is a perfect example.
If you look at our numbers and you compare that from you know early February for these other countries, then for what we see here in the United States from March into April and then the city, I think what you really see is that flattening the curve, you know, has really helped. You know, it doesn't seek to reduce the total number of cases. It just seeks to take those cases, spread them over a longer period of time, give yourself enough time to bring in resources like PPE and testing supplies, and give your medical community an opportunity to be able to treat those patients. And I think we've definitely borne that out here.
No, I think we've been successful there. So, you know, as we continue to move along, pivoting, it's time to pivot. The governor has indicated that. So, I mean, we need to do it on a local front. The governor will be doing it on a state front. But as we get ready to pivot this and still continue to work on the public health portion of it, we really need to work on also getting county government reopened and then getting ready for when the state contacts us and tells us, you know what, all of these non-essential businesses, it's time to move them into the essential category. So we're really working on the pivoting section of it right now. And what we've come up with is our plan to safely open county government. You have to remember a lot of our buildings have been closed for a period of time, and they weren't closed because the governor ordered them closed. They were just closed because everybody was staying home and so forth. So on May 4th, we'll begin the transition of reopening county government. And we're using what's called the Smart Start approach. We're not just going to open everything up and tell everybody to come in. We're going to open it up very slowly by appointment. So before we went into non-essential and essential workers and so forth, our IT department came up with scheduling components where different county offices would have a scheduling component where the residents could log into the county website and they'll schedule appointments. So that's how we're going to open it back up first, starting May 4th, a week from Monday. Remember, in reopening county government, the key factors: keeping the public safe, keeping employees safe, finding a way to slowly and effectively bring back the services that the taxpayers are paying for. But while we're doing that, we all need to remember we have to work together as a community, as a county, and we need to understand why we're taking it slow. The last thing we want to do is do something that triggers a cluster, or we're not doing something smart, so the infection rate starts to grow, hospitalization rates start to grow, and so forth. That's what we don't want to have. So we're going to take it slow. So for the first 2 weeks, we'll do appointment only. Myself and the sheriff and Pete will look at and see if we've had any clusters, if we've had any infection rates that don't look the norm because we've opened these buildings up. But a lot goes into it. In the last week alone, we've had to visit all the county office buildings and see what type of protection measures need to go in place. So, for instance, shields to protect the employees, so there's a glass between the employee and the customer. So there's a lot to be done throughout the county. I mean, unfortunately, there are some jobs where one-on-one contact is going to be necessary. And although you can abide by the 6 foot of social distancing, we can't put a partition between everybody and everything we do in county business. One of the first buildings to open will be the county executive's office in the Hazlet building. And we have HR, civil service, employee benefits in there, so we're going to get that back up and kicking by appointment. There'll be scheduling components, like I said. I'll let the sheriff talk about the sheriff's office because some of those involving the sheriff's office are a little bit more complicated.
So certainly our biggest concern is the safety of the public and also our employees. People need to remember that law enforcement are essential. If law enforcement goes down, we're going to have a bigger problem in our society. So we're being very, very cautious. We're having a lot of discussions on the best approach to opening back up in the manner in which we're going to do it. I think the recommendation of scheduling the appointments is going to be very key and crucial for us to do it very slowly and safely for everybody. As the county exec alluded earlier, very early on, I can tell you, we were very strong in Second Amendment rights around here, and I'm a very big proponent of it as well. And people have the frustration thinking that the sheriff's office controls every aspect of this process of getting a pistol permit and being able to register your gun. We are one process in that, or we're one component in that entire process. We can facilitate an application and push that application through, but the county court judges aren't reviewing those files right now. The gun stores aren't open to even get a gun, so we're just one component in that. We really want to remind the public that it doesn't really make a lot of sense to open up entirely if you're not able to accomplish everything you want. There are some components of the pistol permit process that can be accommodated that are outside of that particular scope, so we're going to work on that and we'll have something listed for the public to move forward there. So our main thing is making sure that the public's safe, but even more so for us, the employees, because of the impact of law enforcement going down.
Sheriff, could you hit on jail visitation and how it's not your decision on how that works?
So with the jail visitation, even early on when this first took off, one of the things we did right off the bat was we discontinued jail visitation for our inmates from any family or friends immediately. This was very important to do. I think we've reaped the benefits of doing that. If an inmate does need an essential type of visitation, either through an attorney or clergy, if it can't be accomplished via video conferencing, we do have what's called a non-contact visitation. Basically, it allows the two parties to interact and meet, but there's a physical barrier between them. They still have the audible communication. Important for people to understand that the Commission of Corrections mandates what any correctional facility in the state does, whether it's a state level correctional facility, a county level correctional facility, or a city lockup, a police department that has a cell or two. They're really mandating how we approach this, the safeguards that we have in place. So we've been very proactive very early on. I think that attributes to the cases of being, nil for us as far as inmates, and fortunately we've had no personnel testing positive either. So probably the other big contributor to that, as soon as an inmate comes into our facility, they are immediately quarantined for 15 days. So that puts them past that potential problematic time to make sure that they're okay.
Thank you. Clerk's office, again, we're going to get the clerk's office reopened on May 4th. It'll be by appointment only, but we will allow attorneys in to record deeds and do research and so forth, and that's not happening right now. So, again, it's going to be a slow process, but we're going to get moving back into it next week. Face coverings will be required in all county-owned buildings. If you come without one, we'll make sure you're provided with one. We'll have them at all the entrances. We'll have sanitation stations where people can use hand sanitizer and so forth. So, again, we're going to roll it out slowly. We're going to look at it day by day, make whatever changes we feel necessary to move us to the next step. With that being said, everyone needs to keep in mind that the economic reopening of Chemung County isn't up to us. That's up to the governor. What the governor has done is he has split the state into regions. Obviously, we're in the southern tier region, and what's going to happen is they're going to, look at the number of cases you've had, the positives you had, the hospitalizations, the deaths, and so forth, and the governor and his staff will make a determination as to when your particular region will get to turn a non-essential business into an essential business. I think it's probably a pretty smart plan. It's, obviously we haven't had the issues that New York City and Long Island and the Mid-Hudson have had, so we've had the opportunity to do better here in the southern tier, so we're most likely going to open up businesses, or they're going to be made essential here before they will downstate. Same thing with the North Country, their numbers have been pretty good. So I'm glad they're looking at it on a region-by-region basis. We haven't been advised as of yet who is going to be our regional representative, but I have had the opportunity to speak with Steuben County and Tioga County. So it is coming. I think the next announcement from the governor's office, we've been told, is May 15th. I mean, that's the benchmark to find out where we're going to the next point. You have to understand we have summer cohesion programs. We have Park Station and Harris Hill, along with all the municipalities throughout Chemung County. These parks haven't been open yet. There's been no Little League. We have high school graduation season coming up. Are they going to be virtual graduations, or is the governor going to allow the students to graduate? So, I mean, May 15th is an important date for everybody to figure out what's the next step in the planning process going to be from summer employment for all the municipalities. Remember those cohesion programs, that's daycare for a lot of parents. So if parents can't go back to work because they have to provide daycare, that really slows down the economic portion. So we're getting ready to meet with whoever the representative is going to be. And I think the first part, like I said, was what we're doing now with county government. The template from the governor's office, the regional template, will be used to analyze infection rates, hospitalizations, and bed capacity, as well as other data to make the decision on reopening different areas of the state. So that's what's happening, and it's obviously we're categorized in the southern tier. If you're a business owner, this is what's important for you to be doing right now. If you've been deemed non-essential, your business should be making a plan. Review how your business interacts with the public. Can it be done safely for both the customer and the employee? Is there any way to minimize contact? Is there a distance of 6 feet that can't be achieved when that happens? Is the customer, do they have a mask, face covering? Does the employee have a face covering? Do you have proper protective measures in place? And probably most importantly, your employees need proper training. So, I mean, the employees need to know what to look for and what to do and how important social distancing is. So, I mean, all businesses who are non-essential right now should be coming up with their plan. So when the governor's office is ready to say, okay, Southern Tier Region, business A, you can go ahead and open. You want to make sure that you have your plan in place so you're going to be able to open under whatever guidelines are deemed appropriate by the governor's office. So if you're a non-essential business, our recommendation to you right now is to begin that planning process so you're ready to open when you do get the okay. And again, being turned essential from non-essential is up to the governor's office. It's not being done at the local level, but Chemung County is in the Southern Tier Region. So when we're advised the Southern Tier Region can move to Step A, the businesses need to be ready and have that plan in place. In closing, we're not out of the dark yet, but finally we can see some light at the end of the tunnel. You need to remember the importance of the social distancing and the face coverings. I know it's inconvenient. I know it. A lot of people think it's infringing on their rights. Look, I'm the first one to want to see everybody get to go back to church the normal way. Everybody get to go to the sheriff's office and file for their pistol permit. It'll come. It's just a slow pace. We all need to work together if we want to have continued success. All three of us would like to thank all the residents of Chemung County. You've done a tremendous job, and again, we'd like to think that's what have kept our numbers low, or at least assisted in keeping our numbers low. And a special thanks to those that are out there serving the front lines, to work for Airways or at the hospital in the emergency room or the sheriff's office, or to work in a correctional facility and have to not know if somebody coming into the facility tests positive. It's a lot of stress. It's a lot of sacrifice from your family. A lot of people are having to work overtime. So again, we want to thank them all from the county level. I want to thank all the county employees, the deputy executive, the planning department did a great job. Pete and his people have been going nonstop for almost 2 months straight. So hats off to everybody, and I say keep up the good work. If you have any questions, we'd be more than happy to answer them for you.
Chris, you talked about the good job the county residents have done, and you don't have to look very far to see that some counties have been really hit hard. I mean, next door in Steuben County, they've just been overwhelmed with cases. They've had a lot of cases and several deaths in Tioga County to the east. What do you attribute Chemung County's to, when you compare your numbers here locally to some of the other counties, we're doing pretty well. Is that everybody doing such a good job? Does it matter happenstance? It's a kind of combination of
You know,
things?
I think it's a combination of things. Number one, nursing facilities very hard to protect. Steuben County, unfortunately, has been hit hard because of the nursing facilities. But I can tell you, and I'd like to think this, I can tell you in February, we had our first meeting with Pete Pizzetti. That's before any cases were even in the United States. People were talking about it a little bit. We started putting plans together. Boy, if this does come here, what would we do? So these guys were leaps and bounds ahead for our county-owned nursing facility, as well as the health department, so we could get ready. And we got that information out to the privately owned health departments, or to the nursing facilities. So, I mean, it's hard to say. I think it's a combination of things, but I definitely would like to think a part of it is the job the residents have done by recognizing the importance of the issue and, you know, abiding by the social distancing and so forth. So I think it's a combination. Pete, I don't know if you see it differently or have
Oh,
another
no,
opinion.
I'd agree 100%, and I think communication has been vital. You know, working with Chris's office has been fantastic. The lines of communication with Chris and Bill and the other departments in the county has been fantastic, as well as our community partners. So Chris mentioned working with the other regional nursing homes, as well as medical providers, namely ARNet. I mean, the lines of communication have been open from the beginning, and I think everyone's had a seat at the table. In addition, you know, I think some things that we've done here predating this, such as our Public Health Emergency Preparedness Coalition, we were able to kind of build on that framework and invite those people back to the table. So I think we were doing things that put us in a good position beforehand as well.
And when you talk about sharing information, we have a weekly call with every municipality in Chemung County. We invite them to call in, the majority of them do, and we share everything we know. School districts, we have conference calls with them every week. So, I mean, communication, all of our department heads, the city of Elmira is involved in all those calls. Either the mayor or the city manager is in on those calls. So I think we've spread the information we have and the importance of the topic to everybody. So, again, I think it's multiple issues that have put us here. I think Pete might be a little bit quiet. I know some emails have come through, but I haven't had a chance to review them yet.
So we scheduled a conference call with Walmart staff and leadership yesterday, along with the county attorney and with Bill as well. You know, we wanted an opportunity to talk to them after we sent out the letter. You know, again, the role isn't to be punitive or anything like that. It's to work together so we can protect public health on this. So we made some requests. We did get some information back this morning. Some of it looks very promising. I had a good conversation with Bill right before this. So we're going to continue to look at that information today and then get in touch with Walmart and have another conversation.
Any other questions?
Other than putting up shields for employees and face masks, are there any other health measures that you guys are going to take to prevent the spread of COVID-19?
Well, sure. I mean, we want to see the offices cleaned a couple of times a day. Somebody needs to have the responsibility for doorknobs, telephones, those types of devices, the facial coverings, the hand sanitizers, you know, all throughout the office and so forth. So, I mean, we keep preaching to them about the importance of keeping the office area clean and so forth, and then we don't want them coupling up. I mean, right now, for instance, our Department of Public Works is open, but our commissioner is making sure the trucks are clean at the beginning and the end of every day. They're not allowed to all come in and have lunch together. I mean, all those small things that you take for granted, but we've taken measures to make sure that people aren't grouping together, and you know, it's changed the culture a little bit, but everybody's been cooperating good. So there'll be guidelines for all the offices, buildings as we open them as to what we want to see.
And Sheriff, is there anything that you're looking for specifically when people call in for COVID-19 related complaints? Is there something that like catches your ear, I guess, when they call in, that you're like, that's what I want people to call in for?
Well, we'd rather have people call in, and we'll decide if it's something that warrants a response from law enforcement. I guess the advice would be we'd rather have them call in and inquire as opposed to not call in and maybe try to handle it themselves. So as they come in, we take a look at it. You know, we get calls of a couple kids playing in a park playing basketball or something. We really got to push back on the parents to say, look, you got to make sure that your kids are following these guidelines as well. Is that really a law enforcement related issue? Probably not. If our personnel are out and they come across the public park and they see a gathering of kids or other people, yes, they're encouraged to interact with them and say, folks, remind you of the social distancing and kind of disperse them that way. So just a case by case.
Okay. Thank you all for coming. We appreciate it. Thank you.